Hello friends. Today's topic is nerve agent. In 2017 and 18, nerve agent was in news for killing of Kim Jong-nam, half-brother of North Korean leader Kim Jong-un, who died after an assault in Kuala Lumpur International Airport in Malaysia, and attempted assassination of Russian ex-spy Sergei Skripal and his daughter. What is nerve agent? Nerve agents are a class of organic chemicals that disrupt the mechanisms by which nerves transfer messages to organs. The disruption is caused by the blocking of acetylcholinesterase, an enzyme that catalyzes the breakdown of acetylcholine, a neurotransmitter. Types of nerve agent. The principal nerve agents are Sarin, GB, Soman, GD, Tabun, GA, and VX. They are man-made compounds that have been manufactured for use in chemical warfare. These agents are known to be present in military stockpiles of several nations. Nerve agents are organophosphorus compounds that are similar in mechanism of action to some pesticides. Properties of nerve agent. Nerve agents are liquids at room temperature. VX has an oily consistency. Nerve agents are very soluble or miscible in water, and soluble in most organic solvents. Sarin evaporates from surfaces nearly as fast as water, but the other nerve agents take longer to evaporate. VX evaporates most slowly, at a rate similar to that of motor oil. The vapor density of nerve agents is at least several-fold greater than air, with VX having the highest vapor density of these agents, about 9-fold greater than air. As a result, following evaporation agents will tend to stay close to the ground. The compounds are either odorless or have only a slight odor. Nerve agent, Sarin. Sarin, or NATO designation GB, G series, B, is a highly toxic synthetic organophosphorus compound. A colorless, odorless liquid, it is used as a chemical weapon. Sarin was discovered in 1938 in Wuppertal-Elberfeld in Germany by scientists at IG Farben, who were attempting to create stronger pesticides. It is the most toxic of the 4G series nerve agents made by Germany. As a nerve gas, sarin in its purest form is estimated to be 26 times more deadly than cyanide. Nerve agent, Soman. Soman, or GD, systematic name, O-Pinacolyl methylphosphonofluoridate, is an extremely toxic chemical substance. It is a nerve agent, interfering with normal functioning of the mammalian nervous system by inhibiting the enzyme cholinesterase. It is classified as a weapon of mass destruction by the United Nations. Its production is strictly controlled, and stockpiling is outlawed by the Chemical Weapons Convention of 1993. Soman was the third of the so-called G-series nerve agents to be discovered along with Tabun, Sarin, and cyclosarin. It is a volatile, corrosive, and colorless liquid with a faint odor when pure. More commonly, it is a yellow to brown color and has a strong odor described as similar to camphor. One of the first observable signs of a Soman poisoning is meiosis. Some, but not all of the later indications are vomiting, extreme muscle pain and peripheral nervous system problems. Those symptoms show as fast as 10 minutes after exposure and may last for many days. During World War II, research into nerve agents continued in the United States and Germany. In summer 1944, Soman, a colorless liquid with a camphor odor, was developed by the Germans. Soman proved to be even more toxic than Tabun and Sarin. Soman was produced in small quantities at a pilot plant at the IG Farben factory in Ludwigshafen. It was never used in World War II, just as Tabun and Sarin were never used as chemical warfare agents. Nerve agent, Tabun. Tabun or GA is an extremely toxic chemical substance. It is a clear, colorless, and tasteless liquid with a faint fruity odor. It is classified as a nerve agent because it fatally interferes with normal functioning of the mammalian nervous system. Its production is strictly controlled and stockpiling outlawed by the Chemical Weapons Convention of 1993. Tabun is the first of the G-series nerve agents along with Sarin, Soman, and cyclosarin. Although pure Tabun is clear, less pure Tabun may be brown. It is a volatile chemical, although less so than either Sarin or Soman. Tabun can be destroyed with bleaching powder, calcium hypochlorite, though the poisonous gas cyanogen chloride is produced. Tabun was the first nerve agent known, a property of this chemical discovered by accident in January 1936 by the German researcher Gerhard Schrader. Experimenting with a class of compounds called organophosphates, which kill insects by interrupting their nervous systems. He discovered that Tabun, as well as being a potent insecticide, was enormously toxic to humans. During World War II, as part of the Grun 3 program, a plant for the manufacture of Tabun was established at De Hernfurth, now Brzegdalny, Poland. The plant began production of the substance in 1942. The reason for the delay was the extreme precautions used by the plant. Intermediate products of Tabun were corrosive, and had to be contained in quartz or silver-lined vessels. Tabun itself was also highly toxic, and final reactions were conducted behind double glass walls. Nerve agent, VX. VX is an extremely toxic synthetic compound in the organophosphorus class. It was developed for military use in chemical warfare. In its pure form, VX is a colorless, relatively non-volatile liquid, taking on a yellowish to brown color when impure. Because of its low volatility, VX persists in environments where it is dispersed. VX is a particularly toxic nerve agent. The potentially fatal dose is only slightly higher than the dose having any effect at all. Effects of a fatal dose are so rapid that there is little time for treatment. Use as a weapon. In December 1994 and January 1995, Masami Tsuchiya of Aum Shinrikyo synthesized 100 to 200 grams of VX, which was used to attack 3 people. 2 people were injured and one 28-year-old man died, who was the first victim of VX ever documented in the world at that time. On February 13, 2017, Kim Jong-nam, half-brother of North Korean leader Kim Jong-un, died after an assault in Kuala Lumpur International Airport in Malaysia. According to the authorities, he was murdered by poisoning with VX, which was found on his face. The authorities further reported that one of the women suspected of applying the nerve agent experienced some physical symptoms of VX poisoning. Recently, on March 5, 2018, British Prime Minister Theresa May has confirmed the nerve agent Novichok was used in the attempted assassination of Russian ex-spy Sergei Skripal and his daughter. Novichok agents are 4th-generation nerve agents and are thought to be far more potent than the V-series agents, for example VX. It is believed that Novichok agents are used in the form of an ultrafine powder, unlike other known nerve agents which are found as a liquid or vapor. Signs and symptoms of nerve agent poisoning. Nerve agents are highly toxic, and even small amounts can cause health effects if they are inhaled, ingested, or if they contact skin or eyes. Health effects occur more rapidly from inhalation and ingestion exposure, within seconds to minutes, than from dermal or ocular exposure. Regardless of the route of exposure, nerve agents can cause the following characteristic effects: confusion, drowsiness, headache, loss of consciousness, runny nose, eye pain, small pupils, blurred vision, drooling, excessive sweating, nausea and vomiting, weeing, more often diarrhea, cough, tightness in the chest, rapid breathing, slow or fast heart rate, low or high blood pressure, respiratory failure leading to death, weakness, convulsions, paralysis. Medical test to determine whether one has been exposed to nerve agents. Medical tests are available, but any delay in administering antidotes to draw blood or collect urine could endanger patient welfare. Other tests can measure metabolites of nerve agents in urine, but their measurement is of little value in treating acute poisoning cases. How is nerve agent exposure treated? Often the most important first step in treating nerve agent exposure is to decontaminate the patient. This is normally done by removing contaminated clothing, thoroughly washing body and hair with soap and water, and flushing eyes with large amounts of water or saline solution. Contaminated clothing should be double-bagged after removal to prevent further exposure. It is important that anyone treating a contaminated person should wear appropriate personal protective equipment to avoid exposure. Nerve agent poisoning can be treated with the antidotes. This is the end of the highly toxic topic. Please like, share, comment. For more videos please subscribe my channel. It's free education.